The counselor as a person and as a professional. In this chapter, we're going to start looking at self-awareness. I hope you did the self-inventory at the first of the chapter. We need to start figuring out what some of our unfinished business is, our biases, and issues like that. Professionals who work intimately with others have a personal responsibility to be committed to awareness of their own life issues. Without a high level of self-awareness, counselors will most likely obstruct the progress of the clients as their focus shifts from meeting the client's needs to meeting the needs of the therapist. Counselors must be aware of their own needs, areas of unfinished business, personal conflicts, defenses, and vulnerabilities. On page 41 in your latest edition, the 9th edition of the book, there's some questions concerning self-awareness. Please take the time to review these questions and answer them honestly. Counselors need to be aware of the possibility of working primarily to be appreciated by others instead of working towards the best interests of their clients. The tendency to give advice and to direct another's life can be especially harmful in a therapist because it leads to excessive dependence on the part of the clients, and it also perpetuates their tendency to look outside themselves for answers. Therapists who feel powerful or important may begin to think that they are indispensable to their clients, or worse, try to make themselves so. Ask yourself these questions. What are my motivations for becoming a counselor? What are my rewards for counseling others? Goals of therapy can also suffer when counselors with a strong need for approval focus on trying to win the acceptance, admiration, and even awe of their clients. When we're unaware of our own needs and personal dynamics, we will probably use our work primarily to satisfy our own unmet needs, or will still steer clients away from exploring conflicts that we ourselves are unwilling to acknowledge. An example of this could be, years ago I co-facilitated an aftercare group for people coming out of treatment. It was a support group and it was a voluntary group. I had to take some time off for maternity leave, and when I came back, there was like 2 people left in the group. I asked them what happened to all the other group members, and they told me that the facilitator would spend most of the group working on his own issues. They said if someone brought up an issue in group and started talking about it, he kind of took it away from him and applied it to himself and then went off on his own stuff. They kind of got tired of it and just quit showing up for group. Counselors can and should be aware of their biases, their areas of denial, and the issues they find difficult to deal with in their own lives. Most codes of ethics address this issue. An example of that would be the APA Code of Ethics. Listen to the code that they have. And this is a quote. Psychologists recognize that their personal problems and conflicts may interfere with their effectiveness. Accordingly, they refrain from undertaking an activity when they know or should know that their personal problems are likely to lead to harm a patient, client, colleague, student research participant, or other person to whom they may owe a professional or scientific obligation. There have been some concerns for substance abuse counselors because in this field is plagued with individuals who, after being abstinent for only a few weeks, present themselves as qualified to advise others. This sets us up for tremendous risk. It's hard to pass on to others what we have not yet learned ourselves. Bissell and Royce, in their book, Ethics for Addiction Counselors, says that there are some unique considerations for counselors who are themselves recovering from the disease of addiction. Having experienced chemical dependency, they say, does not guarantee immunity to any other illness, mental or physical, and no single personality type is either fated to develop a problem or sure to avoid it. They suggest then that it's really important to take care of yourself. One thing they recommend that can be done, not for everybody, but can be done, is getting involved with the 12 steps of Alcoholics Anonymous, specifically because they do provide a moral inventory, a discussion of character defects with someone else, and an ongoing effort at self-monitoring. If negative feelings last too long or grow too strong, the temptation to reach for a drink or a drug just might be too great to resist. Continuing to work on one's own recovery is recommended. Also, having a well-established code of ethics, both professional and personal, can be a good source of inner strength and confidence. Look at your 2014 ACA Code of Ethics that I had you download. See if you can find which ethical code addresses this issue. There are several reasons why potential counselors should be encouraged to experience their own therapy. First of all, those who expect to counsel others do well to know what the experience of being a client's like. Therapy can help you take an honest look at our motivations in becoming a counselor. Most of us have blind spots and unfinished business that may interfere with our effectiveness as a therapist. Although you don't need to resolve all of your personal problems, you should at least be aware of them and the ways in which those problems may affect your professional work. Research has indicated that graduate students in the counseling programs felt that their experience in personal therapy was really positive, and they viewed this experience as important for practicing as a therapist. One of the things that the students found out when they started having therapy is that there were several issues that came to surface. One of them, they said, was a need to tell people what to do, a desire to take away all their pain, a need to have answers to all the questions and to be perfect, a need to be recognized and appreciated, a tendency to assume too much responsibility for the changes of the clients. I remember I had a counselor tell me one time, I called her up and said, I was doing an aftercare program, and I called her up and said, "Oh man, Roberta, you did such a good job on this client. Their recovery looks really good. You did great." And she said, I don't take responsibility for their recovery because then I have to take responsibility for their relapses. I just give them what they need, guide and direct, but I don't fix them. That was a really good learning experience for me. At the time, I was a really new counselor, and I've never forgotten that. A fear of doing harm is a big one, however inadvertently. A tendency to deny or not recognize client issues that may relate to their own. Although it's not appropriate for supervisors to function as therapists for their supervisees, good supervision at times can be pretty therapeutic, in the sense that the supervisory process involves dealing with the supervisee's personal limitations. The authors do believe it is appropriate for supervisors to encourage their supervisees to consider both personal therapy with another professional as a route to becoming more effective both personally and professionally. Truly committed professionals engage in a lifelong self-examination as a means of remaining self-aware and genuine. Three outcomes were seen as the most beneficial: self-awareness or self-understanding, self-esteem or self-confidence, and improved skills as a therapist. When you're talking about substance abuse counselors, when we look at being self-aware and staying on top of our issues, we found that if a counselor relapses, at that point that they relapse, the credential of a successful role model is lost. The issue should be discussed before it happens, and the counselor should understand the policy of the organization. Even counselors who aren't in recovery, so to speak, really need to look at what the policies are, just in case some impairments take place, or maybe you have a relapse or develop a problem yourself. I really want you to take the time to completely understand transference and countertransference. It's such a huge part of the counseling process, and you really need to understand what it's all about. Transference and countertransference refers to the client's general reactions and orientation to the therapist and to the therapist's action in response. It's assumed that transference and even countertransference occurs at some level in most relationships. How counselors handle the client's feelings will have a direct bearing on the therapeutic outcomes. Transference is the process whereby clients project onto the therapist past feelings or attitudes they had towards significant people in their lives. Clients' unfinished business produces a distortion in the way they perceive and react to the counselor. They can experience love, hate, anger, ambivalence, dependencies. These feelings are rooted in past relationships, but are now directed towards the counselor. Remember that this doesn't mean that just because a client expresses anger, it isn't justified, or caring feelings may be genuine. So let me give you an example of some transference, even though it wasn't from a client to a therapist. One time I was doing a group, and there was a girl in group, and she was a younger woman, and she kept reacting kind of hostile to another group member who was an older male. I mean, he didn't even say anything offensive, but just the way she looked at him, just the way she responded to any of his comments were really quite hostile. So one time in group, I stopped her and I said, "Who does Bill remind you of?" And she said, "He is just like my dad. He acts like my dad. He looks like my dad. I guess that's why I'm reacting this way." That is a pretty good example of transference.